Hi everyone, I'm Lana Zach. April is Child Abuse Prevention Month, and states are reporting a drastic decline in calls to child abuse hotlines. But officials believe that more cases are going unreported due to schools being closed. Teachers are usually some of the best eyes and ears for suspected cases of abuse and neglect. Anna Gassman Pines is an associate professor of public policy, psychology, and neuroscience at Duke University. She joins me now from Durham, North Carolina. Anna, how might the pandemic actually worsen situations involving child abuse or neglect?
That's a really great question. And what we know from the research is that when families are under economic strain, they are more likely to experience child abuse and neglect. And one of the main things that is happening during this pandemic, in addition to all the concerns about our health, is huge increases in disruptions in work, huge increases in unemployment, and losses of income for families. And that has almost certainly increased economic strain for many parents.
Do you have suggestions for parents feeling stressed out about ways that they can help calm their emotions?
That's a really good question, and I think it's really hard to know. This situation is so unprecedented. The scale of the disruptions to daily life, to workers' lives, to children's lives is really overwhelming at times. And I think our research and our social science really almost isn't equipped to know what best to say in these situations. But one thing is to just remember that keeping kids safe is more important than a few days of lost schooling. So, for example, if it's difficult to try to help children with distance learning, and giving it a rest for a day or two will help ease tensions in the household, that's a really important thing to do.
And I imagine not being afraid to seek out help when you need it, even though we're in lockdown and all isolating when it comes to the welfare of children. That's an important time to figure out another solution, I'm assuming.
That's right. And to try to do what you can to improve your family's financial situation. It's a really difficult time. So many people are out of work. Even those who are still working have had their hours cut. Our social services systems are strained. The wait times on hold with the unemployment insurance offices have been tremendous. It's really difficult to be patient and to try to access those services, but there are services and supports available, including expanded unemployment insurance. Policymakers are working hard to try to help families, and any way that families can access those services and keep on being able to pay their bills to reduce that strain will be helpful.
Now, some of the states are actually seeing child abuse reports decline by as much as 50%. Is that just because teachers aren't seeing their students because of COVID, or are there other factors?
It's hard to say for sure, but I think you're probably right that teachers are really on the front lines of helping our systems identify families that might be struggling and where there might be child maltreatment. And we know that teachers are very important reporters of suspected cases of child abuse and neglect. And one of the ways they do that is by seeing children day in and day out in the classroom. So even though teachers are working so hard around the country to provide educational enrichment virtually, it really can't substitute for the kinds of interactions that they are having directly with children in the classroom.
I'm wondering if there's anything that can be done to protect children at risk of abuse during the pandemic. Any suggestions that you can make, or policy issues that policy leaders should be considering right now?
Well, we're in a crisis situation, and I think that all of our policymakers are really trying to do the best they can in the moment. In the longer term, one thing that this crisis has really laid bare is the need for paid family and medical leave insurance in this country. There are now many states that have statewide programs, but it's not something that's accessible across the country. And all of a sudden we're all realizing anyone can get sick and need to take time off of work, or have a family member, a loved one who's ill and need to take time off of work to care for that person. And what a paid family leave insurance program would do would be to allow those people who are ill and need to take time off of work, or who are caring for an ill family member, to be able to continue to get some of their earnings while they're away from work. And importantly, there's very good evidence that in addition to providing that financial support for families, paid family and medical leave insurance also reduces child abuse and neglect.
Tough subject, but with awareness, hopefully, comes action. Anna Gassman Pines, thank you.
Thank you so much.